Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
Brother Edward, we are live. You're muted. You're muted, Brother Edward. You're muted. You're muted. We can't hear you. Okay.
I'm going to correct that right now.
You're having a great conversation by yourself.
Yeah. Because, that's just a prelude to what's going to be doing tonight, okay, this evening, broadcast. Talking about a subject that I'll tell you is needed to be talked about for a long time. But today we got somebody that's going to talk about a disease that is not talked about very much, right? Since Steve had some advanced treatments, things are kind of level off, and people, the victims are living much longer and significantly longer. And rather than the particular time. But this is a very important topic to me because it hit my family very much. So, but we got some warriors tonight who can really shed some light on some new details. So I think you're better capable of transporting that information than I am. So let's do it. Why don't you do it?
Let's get into it. So thank you all for joining us tonight. We really do appreciate it. And we have some very special guests with us from our local backyard and also just down the street into the Low Country from MUSC. And we're going to bring on our special guest for the evening in just a moment. Just want to remind our viewers that you can join the conversation and add your comments and questions in the chat. We will show the chat questions on air so that our special guests will have an opportunity to respond to any questions or thoughts that you may have about tonight's topic. And we hope that you enjoy. Please share this from your Facebook pages, or if you're viewing this from the World Community Magazine's website or our YouTube page, grab a link and send it out as soon as possible. This is critical information, and Brother Edward is right. We don't talk about it enough. And so we have Shauna Riley and her son Tyquel with us tonight to kick us off. How are you doing? Oh, you're muted as well. It's the mute game tonight. How are you?
We are blessed. We are honored to be here.
Absolutely. We're actually honored to have both of you here. And, we are excited that you are doing the work and that Tyquel is living the story so that he can be a testament to, what this fight is like and how you can not only live through it, but you can also beat it. And so we have some really important information that we want to disseminate tonight to our viewers. And before we get started, of course, you two are the founders of the Riley Foundation, correct?
Correct.
All right. So why don't you tell us a little bit about who you are, but also about the Riley Foundation?
Well, my name is Shauna Riley, and I am from North Myrtle Beach. This is my son, Tyquel. He's a man of very few words. But he is my sickle cell warrior, and because of him, we founded the Riley Foundation for sickle cell disease.
Mm-hmm. Okay, so you said because of him, that means that he has a story to tell indeed. So When did you all begin your fight?
He went through his first crisis at 5 months old.
Wow, since he was a baby.
Yes.
Amazing. Yeah, that's absolutely amazing. And, as a mom, as a parent, did you have any idea that he was actually dealing with sickle cell, or how did it come? How did you find out about it?
I want to say I received a phone call from DHEC. He was having some health issues, but at that time we didn't even know it was sickle cell. We were just thinking it was, colic, or causing him to cry and scream. But once we found out he had sickle cell, that's when we found out what the hollering and screaming was for. Mm-hmm. So like I said, he was about 5 months old when we received that phone call. So that's when we really knew what was going on.
Mm-hmm. And so Tyquel, how old are you now?
I'm 23.
23 years old.
Yeah.
Wow. All right. So 5 years old.
5 months.
5 months old. 5 months, you're faced with this crisis. Your baby is diagnosed with sickle cell. What were some of the thoughts that were running through your head?
When I received the phone call, which DHEC does it totally different now, and it's probably because of my reaction when they called me, because all I heard was disease. And when I heard disease, I kind of just lost it, But now every newborn for the past about 25 years has been screened. Every newborn in the U.S. is screened for sickle cell. So DHEC will contact you to even let you know if your child has the trait, because my daughter carries the trait. So I was notified, but they made me come into the office to do it.
Okay.
So yeah, things have really changed.
Have changed since then.
Yes.
So Brother Edward, I know pre-show you were saying that this is something that has personally affected your family as well.
Yeah, absolutely. My during the time when the advancements were not as prevalent as they are today. This was back in, I think, 74. My sister, who was at the age when she had it. She had sickle cell, and she was at the age where what they had predicted as her time frame of, the demise. I'm going to use that word for lack of a better word. But the advances today are such that people are living 2 times that age, what she was, and she was, the age that they predicted, which was 34, and they didn't have, I guess, the blood transfusions or the stem cell, any kind of technologies they had. Of course, they tried to get rid of all the blood she had and then replenish with a different kind, but nothing, that didn't work. Okay, I'm sure you must have seen that before, but that didn't work. Yeah, that didn't
An
work.
exchange. It's instead of a transfusion, it's a blood exchange.
Right.
He's had 2 of those.
Yeah. But he's, I think he's going to be fortunate. I think he's going to do very well. Now, they can, the lifespan is triple, really. I mean, they've made some advancements. In fact, it was so good, the advancement was so good that Howard University just closed down its research facility in DC. Howard University, that was the only dedicated sickle cell sickle cell research center at any school at Howard University. So I guess the advancements were coming so fast, and they really concentrated on it. However, it has subsided. As far as I'm concerned, it has subsided. Okay, to the point where it's not as.
If they've advanced it that much, I want to know why hasn't it hit South Carolina yet? Where is it at?
Okay, I'm going to opinionize on that and say the advancement, it caused all that. Okay, caused them to because it was a grant situation. I mean, the grant was big enough that they built a new building for it. So, having said that, I think it just needs to be talked about a bit more now. I think it's subsided to the point where, to me, it's dangerously low and dangerously not being discussed. However, hopefully we can get some information from you and Taquel. You said he doesn't talk a lot. We're going to get him to talk tonight.
Taquel.
That's all right. We're going to get you to talk this evening. So,
all right.
Yeah, but I know you're a brave warrior, Taquel, and you got to just maintain that, man. Okay.
Yeah.
They're making advancements every month. Okay, every month. So, but it's good that you're coming in and sharing it with our audience. We certainly appreciate that.
Mm-hmm. So Shauna, why did you see a need to create this foundation?
My need, I saw a need years ago, but now with my son being an adult with sickle cell, it's a big transition. From the care that children receive for sickle cell disease and the care that adults receive. And I speak with several people constantly about the mistreatment of patients with sickle cell disease. So I feel like it's our responsibility to go out and speak for those that can't speak for themselves.
And how long has your foundation been in existence?
We've been in existence since 2019.
2019. Okay. All right. So, that's 2019, of course, we moved into COVID. So I'm sure that, any type of awareness was probably overshadowed by the pandemic at the time. But I'm glad that you're still pressing forward to make sure that there is an awareness of, the cause, the treatments, the things that are being done to advance medical practices to deal with sickle cell disease. And so that's why we also have our other special guests with us, and I'm going to bring them on the screen now. And you can actually kind of do the honors for us and take us around the screen and let us know who your friends are from MUSC.
Well, these are the awesome ladies of the, well, I've met them through the Pediatric Sickle Cell Clinic at MUSC. I've been dealing with Miss Mary Johnson here for years and years. Dr. Jurassic here, I've met Dr. Jurassic maybe 2 or 3 years ago. She's actually over the bone marrow stem cell treatments there. Correct me if I'm wrong, Dr. Jurassic. I know that's what we discussed.
Nope, that's what I do.
Okay. And Dr. Abrams is like very new to MUSC sickle cell. So she's new to me also, but I know if she's a part of that team that we have nothing to worry about.
Oh, awesome. Well, again, welcome and thank you all for joining us tonight. And, I'm looking at the titles on the screen and I see that Dr. Abrams is Clinical Director of Pediatric Sickle Cell. Dr. Jurassic, you're also Director of Pediatric but Non-Malignant, BMT. And of course, I'm sure you're going to explain those acronyms later. And then Miss Mary, you are the Pediatric Sickle Cell Clinic. You're in the clinic. You work in the clinic. And what is your role in the clinic?
Well, actually, I am one of the nurse practitioners in the clinic, and primarily I see the patients, manage their care, write orders, handle phone calls. I'm there when they need me. So it's really managing the day-to-day aspects of their care.
Okay.
And our patients come in frequently, and that's important because we screen for complications that can come up with the disease and catch them early. And then we also do things in clinic, like we can treat for pain and we can do transfusions. Some of our patients require blood transfusions regularly. And there's also some new treatments, some IV infusions that have come out in the last 3 years that can help our patients who have frequent pain.
Okay. So, doctors, if you will, explain to us what exactly is sickle cell. Whoever wants to take it.
Here, I can take that one, and I'll let
Okay.
Dr. Jurassic talk about all the transplant stuff coming up later.
Awesome.
So, sickle cell disease is a disorder that affects your hemoglobin, which is a molecule that fills up our red blood cells and helps us to carry oxygen around our body. And so if you have a variant like one that would make sickle cell, you get these long kind of sticks within your red blood cells, and it makes them very inflexible and it makes them very prone to breaking. And because of the inability to be flexible, they're going to get stuck. It's going to cause blood to not be able to flow to different areas of your body. And it's also going to cause problems with inflammation and all the problems that can come along with poor oxygen to tissues and inflammation. And so because of that, you see some of the things that we were talking about, like you can have very frequent painful episodes. You can have issues with having strokes at very young ages. You have issues with your heart function, your lung function, as well as difficulty with organs in your belly, like your spleen and your gallbladder.
Mm-hmm. So about how many children are impacted or affected with by sickle cell annually?
So there's about 100,000 individuals living with sickle cell within the United States, and that's a very rough estimate. Probably the better estimates are about 1 in every 300 or so births are affected by sickle cell disease. And then we were talking about sickle cell trait, where you have just one of the variants that you inherit, and that affects about 1 in every 13 Black or African American births within the United States. And then globally, it's about 3 times as common as in the United States, so about 300,000 individuals every year are born.
And is it predominantly a disease that affects African Americans?
Yeah, so if you look at maps of the prevalence kind of across the world, you'll see it in areas that are highly endemic for malaria, because sickle cell trait specifically provides evolutionary advantage to help you not get as sick with malaria. And so you're going to see it a lot in Africa, as well as some of the Middle Eastern countries in India. So it definitely affects African Americans more than other ethnicities. Latinas as well are affected, not as frequently as African Americans, though.
Okay. So, Dr. Jurassic, you are on the treatment side.
I am. So, I've been taking care of patients with sickle cell disease and doing transplants since the late 1990s. And we've learned a lot since then. So, what we know about sickle cell disease, like Dr. Abrams explained, is there are symptoms: vaso-occlusive crises, stroke, acute chest syndrome, all problems that are related to the sickled cells blocking blood flow and then causing problems from that. What I explain when I talk to families about potentially curative therapy is that even on days when patients aren't having sickle cell symptoms, they still have the sickled cells in their bloodstream, and those pointy edges of the sickled cells irritate the blood vessels throughout your body. So even though they may not be having symptoms that day, they're still having organ damage that accumulates throughout their lifetime. So, we have made great strides in controlling the symptoms, particularly controlling the symptoms well in childhood. But what I see is when patients are transitioning out of our pediatric clinic, where Miss Mary and Dr. Abrams have taken meticulous care of them throughout their lifetime, they're transitioning to providers that may not be as familiar with sickle cell disease and may not be prepared to take care of organ damage that shows up in patients at 20 or 30 years of age that they normally don't see in patients until they're in their 60s or 70s. So what we do know is even today, patients born with sickle cell have an average life expectancy of 42 years. We have not moved that number significantly. We are definitely taking better care of patients. We are definitely controlling their symptoms better. But these are all called disease modifying therapies. So it treats the symptoms, but it doesn't treat the underlying cause of the disease. So the only known established cure for sickle cell disease is bone marrow transplant. And what that involves is getting rid of the blood forming and immune system of the patient who has sickle cell disease and replacing it with someone who either has sickle cell trait or no form of sickle cell in their bloodstream. So the donor actually donates blood or bone marrow, and then that blood or bone marrow builds a brand new blood forming and immune system for the patient, and then the patient no longer has sickle cell disease. So when they come into the hospital for transplant, we do the exchange transfusion, Shauna, like Tyke Wales had before, and get his percent S down to less than 10%, so that while they're in the hospital for the prolonged 6 to 8 week stay in the hospital for transplant, they don't have any sickle cell problems because their sickle cell percent is so low. Then we give chemotherapy and immune suppressive medicines to get rid of or suppress the patient's blood forming and immune system. Well, the donor cells have a chance to get into the bone marrow, start making new cells, and start making new cells that don't have sickle cell disease. So we have learned a lot about taking care of patients since the late 90s going through transplant. And it used to be that you had to have severe sickle cell disease. So 3 episodes of painful crisis per year in the 2 years leading up to transplant, or you had to have had a stroke and be on chronic transfusions, or you had to have had 2 severe episodes of acute chest syndrome to warrant the risk of going through transplant. That's where we started in the 1990s. So we transplanted people who were very sick with sickle cell disease, and we took them to transplant if they had a fully matched sibling, because that's the safest kind of transplant to do. And what we saw was after transplant, patients had no further vaso-occlusive events. They had no further strokes. They had no further episodes of acute chest syndrome.
And what we're learning over time for having followed those patients for so many years is that their sickle cell organ damage stops at the time of transplant. Transplant won't go back and fix things that have already happened, but it prevents further organ damage. So that's where we started. And since then, transplant has gotten safer and safer. So now what we use as the criteria to consider bone marrow transplant is not having symptoms at all. If you have a matched sibling donor and you have a diagnosis of sickle cell disease, that is an indication to consider transplant, because 95% of those children are cured of their sickle cell disease, and depending on when you do the transplant, may never have any sickle cell symptoms. Mm-hmm. So if you have a fully matched brother or sister, you should talk to your doctor about bone marrow transplant, because it might be the right thing for you. That's the safest kind. Now, we still have patients like Taekwondo who are symptomatic and don't have a matched sibling. And then transplant gets a little trickier because you have to use a mismatched relative or an unrelated donor. And that's one of the reasons why identifying donors is so important. Within the National Marrow Donor Program, African Americans are underrepresented. So when I search for potential donors, they're not on the registry, because you tend to have and share white blood cell markers within your community. So if your community is underrepresented, everyone who's looking for a donor is looking for a pool that's very, very small. So encouraging people to get on the registry is so, so important for people who would like to go to transplant if they had a good donor. And getting on the registry is easy. They do a cheek swab. And then your information's in the system. And if you're a potential match for someone, they'll contact you and say, you're a potential match. Are you still interested in donating? Doesn't commit you to doing anything. It just gets your white blood cell markers into the pool of people who could possibly donate to save somebody's life or, change somebody's life.
So this question is for the staff members of MUSC, because you're working in this every single day. I know that you mentioned the challenges. There aren't enough people who are, getting the swab so that you can find out what's going on. What do you think is the main reason why there is a challenge? Do you think it's just a lack of awareness in the African American community about the importance of this? Are people just not really considering it because they're thinking, well, I don't have sickle cell, or I don't know anyone who has sickle cell, so it doesn't affect me. Or is it access? That even if they want it to be a match, they don't know how to go about, or if they want to see if they're a match, they don't know how to go about, starting that process. So what do you think are some of the challenges?
I think you identified a lot of them, and I'm sorry, Dr. Drexel, you can go.
No, you go ahead, Mary.
Tag in here. I think you identified all the problems. I think it's a lack of awareness, a lack of how do I do this? And then I think there is some resistance, and we can talk about, I think, there's been, you hate to say good effects of the COVID pandemic and bad effects, but there have been. I think people are a lot more hesitant now since the pandemic because of the whole immunizations and feelings that are, kind of arose around that. So I think that has affected us a little bit. But I do, and that's the same way I know we want to touch on a good, diverse donor blood pool too. We need blood transfusions. Taekwondo needs blood transfusions at times when he's very, very sick. And often we have to wait a while to get the appropriately matched blood for our patients when they're very sick. So awareness about blood donation and awareness about joining the registry. And I know Dr. Jurassic can touch more on that, but yes, everything you mentioned is a factor. And so that's why this kind of forum is helpful to get the word out.
Dr. Abrams, I'll come back to you in just a moment, Dr. Jurassic. Dr. Abrams, whenever you have, parents who are bringing their children in, and you're diagnosing these cases in young children, what are the financial implications? What kind of impact does that have on people? And I'm sure that that's probably a deterrent too when it comes down to seeking treatments and also, you know, getting the proper care. There's so many social determinants of health that impact how people move when it comes down to their health, and if they can even move when it comes down to their health. But, you know, what are some of the cases that you've seen and you're like, wow, you know, this child really needs some help, but this is happening to the parent? What can you share with us?
I mean, that is a daily struggle that we have in our patients with sickle disease. Not only do we have some of our patients themselves that have sickle disease, but sometimes multiple children in the family might have sickle cell, or the parent might be affected by sickle cell. So you can just imagine how a parent who's lived through their life trying to deal with their disease back when the treatment and therapies for disease modification weren't as good, and now trying to help their child have better pain control, better disease control than they had. And then all the kind of social determinants, including how far away patients live from the clinic downtown. I mean, a lot of our families travel between an hour and a half and close to 3 hours to get to our center downtown. Not to mention the downtown Charleston traffic is not easy to navigate either. So kind of making sure that we are understanding to those other aspects that are affecting their care. So when a patient can't be on time because the person that was supposed to give them a ride couldn't make it because that person had other social obligations, because there's so much support that goes into taking care of an individual with a chronic medical condition, specifically one that is so devastating to the child and the family. So, and along with that is all the hospitalizations that they might have starting from very young ages. I mean, for the first year of life, anytime that an individual with sickle cell disease has a fever, they're going to have to get hospitalized for at least 48 hours. And so that's not just coming into the hospital and talking about hospital cost. It's childcare for any other children. It's missing work because you can't leave your 1-year-old in the hospital by themselves. And then also sometimes parents having to struggle to make those decisions of, I need to put food on the table and I can't stay at the bedside right now because I need to go take care of this. So just kind of navigating all of those complex interplays. And then that's not even touching on when our patients get older into that young adolescent and can potentially not be covered on their parents' insurance anymore. And so we're dealing with that now, kind of with the kind of changing landscape of Medicare and Medicaid. So we're trying to kind of rally. I think that's one thing that we do well at MUSC is we have a lot of support people. We have dedicated social workers for our clinic. We have now a licensed professional counselor. We'll have a psychologist within our clinic as well coming in the summer. So I think MUSC does a fantastic job trying to rally the support behind the patients to help get them the care that they need. Not to mention how wonderful Mary and Leisha are with helping kind of field questions and be the really touch point for all these families. So I think the people at MUSC are really helpful in getting the patients the care that they need.
So Dr. Jurassic, I know you were going to tag on something that Mary was talking about. Just expand on what she was saying a little bit.
Yeah, so I think one thing you didn't mention that may preclude people from wanting to become a donor is sometimes when you see, bone marrow harvests on, medical TV shows, they just look like painful and hard to go through. And I'm the person who collects the bone marrow. So it really isn't like that. If you're donating bone marrow, you're going to be under anesthesia, asleep on the table, and we're going to give you a nerve block so that you feel fine when you wake up. They need pain medicine for 2 or 3 days after you donate bone marrow. But it's really safe enough that we ask people who aren't even related to the patient that they're donating for to go through the procedure. It's that safe. And the, medical follow-up is really just getting your blood counts checked a week after you donate. So I think there's some fear about how do they get the cells they need? And, is it time off work and who pays for it? So when we take someone to transplant, all of the donor collection charges and stuff are paid for by the patient's insurance. So it doesn't cost anybody anything to donate other than their time.
Gotcha. We have a question in the chat, and it actually comes from Sister Joella, who is the wife of Mr. McQueen here. And she asks, does the affordable health care insurance help?
It actually does, because the affordable health care insurance, if you have insurance and you have a qualifying need, especially if you're a pediatric patient, MUSC will work with your insurance company and, teach them, inform them why bone marrow transplant is cost effective and best for the long-term life of the patient. So yes, having the Affordable Health Care Act, where more people are covered, definitely gives more people access to both sickle cell care and transplant services.
Okay. Brother Edward, I think you had a question.
I wanted to just ask the question. I know, Dr. Jarosky, you mentioned that the average sickle cell person lives to the age of 42, I think. Is that correct? Now, was that with the new treatment that you were offering, or was that before?
That was before, and there have been about 1,000 patients who have gone through matched sibling donor bone marrow transplant, and there are about 1,000 additional patients who have been through some form of unrelated donor transplant or other type of transplant. But when you compare that to the 100,000 people with sickle cell, that little 2,000 hasn't pushed that number up yet, but I think it will in the future. And the disease modifying newer treatments that Ms. Mary and Dr. Abrams were talking about have just become available within the past, since COVID, I would say. So since 2019, when they started becoming FDA approved. So in order to impact lifespan, people are going to need to be on those medicines for a while to moderate their symptoms and hopefully make their organ damage less severe. So I think all of the things we're doing today are going to push that number, but I think it's going to take a few years to push that number by offering these new treatments and stuff to more patients.
Yeah, I just want to elaborate on that a little bit more. And thank you for that. Now, the bone marrow. Now, if an individual comes to you or whomever who's the recipient of the bone marrow, how long can you preserve it if a person just came to volunteer, not for any particular person to be the recipient, but how long can you keep bone marrow?
So we don't keep bone marrow, but people who donate the umbilical cord blood when a baby is born, that stays in the freezer for 20 or 30 years and could help anyone who needs it.
Okay.
But when we have to take someone to the operating room and collect the cells, we only do that when we know they're going to a specific person, just because sedating someone, scheduling OR time, because the white blood cell marker system is very, very complicated. We have, I think 3 million people in the registry. And still, often when I do a search, I can't find anyone who's an exact match for the patient I'm looking for. So we only collect it when it's for a particular patient, and the bone marrow travels to wherever my patient is that day. It can be collected in the morning and come to me later in the afternoon from just about anywhere in the world.
So let me just diverge a little bit. How do you deal with two people who, how do they deal with it anyway regarding having children if they know that they have the trait, if both know that they have the trait? Is it encouraged to continue on in a normal phase of having children, or there's this caution there to say don't have it?
I think that's really a personal family decision, because remember, some of the people who will pass on the trait actually have sickle cell disease themselves and they're living with it. They know what the diagnosis means. But we know based on inheritance, if each of the parents has trait, each baby has a 25% chance of being born with normal hemoglobin, with no evidence of trait. Each baby has a 50% chance of being born and having sickle cell trait. And then there's a 25% chance that a baby born would be affected with sickle cell. So we counsel the family so they know the numbers. And it's really a decision kind of each family has to make. There are fertility services, but that makes the whole process a lot more complicated.
And I will say that when we have young parents that bring their young children into the clinic when they have a diagnosis of sickle cell trait, that's one of the things that we do try to impress upon them the most, is that this is not going to affect your child right now, but it's something that needs to be discussed as they get older so that they know their status. A lot of times women who are pregnant will get tested for sickle cell trait, but a lot of times if the young men aren't made aware that they have sickle cell trait, they really don't know. There are some kind of drives popping up around that can get you tested for sickle cell trait, so you know if you're carrying the trait or not. But again, it's remembering that, oh yeah, back when he was born, he was diagnosed with sickle cell trait, so that he can know that going forward to make informed decisions.
You mentioned the umbilical cord blood a little bit earlier.
Mm-hmm.
Okay, so a donation of umbilical cord blood, does that happen prior to someone giving birth? Does it happen after birth and they're asked the question? Because that seems fascinating to me. And my thought is, if I imagine it's as simple as just donating the umbilical cord blood. What are some challenges with that, and why are you seeing a lot of that?
So there are several centers in the United States, in New York City and Durham, North Carolina, in California, where they have big hospitals where they are collection centers. So if you are delivering at one of those hospitals, they ask you during your prenatal visits if you would like to donate your cord blood to a public bank. And then after the baby's born, they take the cord blood, they do the testing on it, and they put it in a public bank. What we've had a lot of families ask about lately, when they know they have a child with sickle cell disease and they're pregnant with their next child, is about directed cord blood banking. So if your child has a diagnosis that makes them potentially need a transplant, you can bank the baby's cord blood for free. You have to reach out to the collection center and they will send a kit that you take with you to your delivery. And then that baby's cord blood goes into a bank and is saved for potentially doing a transplant for their other child if it's a match. So we've had a lot of families who have asked about doing that lately, and we send them to the sites where they can request the collection kits, and then the sites send the collection kits out. And I haven't had anyone who's been a match and gone to transplant yet, but if parents know they have an affected child and are having another child, we definitely encourage them to do that because it just opens their options a little bit.
I have a question.
Mm-hmm.
Does that next child that she's pregnant with have to have the same mother and father?
That's a good question.
Yes, to be an exact match, they would.
That's a good question, Shauna.
Because I know I would never have another child with my son's father just because of the chance of that child also potentially having sickle cell. So that would not have even been an option for me.
Yes, and some families feel that way. So we try and keep everybody's options because each family, views that decision a little differently.
Right.
Well, I tell you, this topic has a lot of depth to it because, tonight, even in just these 45 or so minutes, we have talked about the effects, what sickle cell is, the population it affects, treatments and processes and procedures, but we've also talked about the challenges due to the social determinants of health and the things that we really need to focus on as far as how to eliminate some of those challenges and the things that exist, and yet there's hope, obviously, and there are people like Shauna who want to work through their own means, foundations, to educate the community, to make sure that people understand the importance of the blood donations, the bone marrow, transfusions, everything that you've talked about tonight. And so, I guess my last question would be, what can the community do to get more involved in this particular movement? There are people who will view this video later and talk about this broadcast, or folks who are probably watching who are not, saying anything or speaking up, but they're probably going through their own personal challenges right now, or they know somebody who is. And this is a lot of great information that we're giving them tonight. So, how can we ignite the community to do something and get more involved in this, so that, we can continue to find cures and to cure people who suffer from this disease?
I think that's a phenomenal question. And I think, one of the things that people don't always understand is blood that you donate in your community stays in your community. So if you go to the American Red Cross, or you participate in a blood drive, or, they have a blood drive going on where you work, if you donate locally, that blood's going to go to someone in our greater community. And our community has a lot of patients with sickle cell disease who need transfusions, and finding blood that is their same blood type with their antibodies and stuff, it can be, like Miss Mary said, can be difficult. And sometimes I think people think, oh, I donate and I don't know where it goes. But if you donate locally, you're donating to someone in our community. And the other point I would make for, I know Shauna is planning on setting up a marrow drive. Anyone who's interested in becoming a bone marrow donor can go to a website called Be the Match. And they have a section on there that is for people who are interested in donating. And, when Shauna does the blood drive, what they'll do is have a little QR code for Ty Quayle's drive. And anybody who scans that code, they will actually ship a DNA swab kit to your house. So you could rub your cheek in the comfort of your own home. They'll send you a box to send it back in, and then you're on the registry.
And I already have a QR code for Ty Quayle.
That's awesome.
That is awesome.
Yeah.
So I'm showing on the screen now the Be the Match website, and I see that there's some familiar faces here. There's Robin Roberts and Nick Saban, and I don't know what their stories are, but it makes me want to click on, these icons on the website just to see, what it's all about. And everyone knows that Robin is a transplant recipient, and so I'm sure that these types of resources are out there. They're available. It goes back to what we said before. People just do not know that they exist. And so, in our communities, we have to do a better job of letting everybody know that these resources exist, and that, there's something that can be done. Everyone can unite to actually move in this fight. So I also want to share the website for MUSC that you all gave us earlier. And again, as you do your work at the Sickle Cell Center, what are some things that people need to know if they're faced with this crisis and they have to come to you? As far as the starting point, yeah.
I hope when people come see us in clinic, that they feel like they become part of our family, because chances are we're going to be following their family from birth through age 26, possibly. So we really want to establish a relationship with our patients and families so that they feel comfortable coming to see us. They feel comfortable telling us how they're feeling and what they need. Because that is so important in medical care, that you understand where patients are coming from and that they feel comfortable sharing with you.
Absolutely.
Miss Mary, what do you think?
You said it perfect. I had a new baby come in today, and I don't know if you remember, Shauna, that horrible first visit when you go. It's overwhelming, and I tell all the new parents, I say, I'm going to work hard to maintain a good relationship with you because I know I'm the only provider in this. We're the only provider in this area. You don't have a lot of choices because not a lot of people specialize in sickle cell disease, but I respect that relationship and I want to maintain it because right now we do follow to age 25, as Dr. Jurassic says. That is a long relationship. I've known Taquel for 14 years now. I feel I have not raised him, Shauna, but I feel like I've raised him a little bit.
You have.
Raising, and you've done an excellent job. So it is a long-term relationship. And I think sometimes in healthcare, we seem a little impatient and overwhelmed, but all of us who are here tonight representing the medical community, we do it because we care about the patients. It does sound corny, but that is exactly, we wouldn't go in. That's the whole reason. There's a lot to put up with in healthcare that's hard to put up with. So we do it because we want to help you. And so we want to maintain that relationship. And we do it because we care so much about the patients and about helping patients with the disease.
Well, I think that is probably the most important part of any care that any patient can receive, especially someone like Taquel, is the empathy that you all extend to them. And so thank you so much for your service and for just doing the wonderful work that you're doing in the fight against sickle cell disease. And Shauna and Taquel, your foundation is going to impact communities more than just locally, and I wish you all the luck with everything that you need to do. And of course, I know I can speak on behalf of Brother Edward and the World Community Magazine that you have our support. Anything that we can do to help bring awareness to what you're doing. And I know Brother Edward, he loves taking pictures, and he'll get someone to write an article. So if he needs to publish the story and get it into the magazine and send it out, I'm sure he's willing to do that.
Great, because we do have a lot of events that are coming up. I actually just finalized some dates today, so I will be getting with you guys to do some things in the near future.
Absolutely.
And
Absolutely.
I would say, Shauna, what you're doing and hearing it from a family who's going through it and a patient who's going through it, the warrior that he is, that is how you get people's attention. As a medical person, I could talk about the treatment, I could talk about the science, but you can talk about what it's like to live with sickle cell and live with a son who has sickle cell. And that's really, when people hear your story, that's what's going to motivate them to help.
I know, Shauna, I know you said that Taquel was a man of few words, but I don't believe that. I think
you see, he's taking himself out of the frame.
He walked away.
Oh goodness,
that's a good way of getting away, isn't it?
He left me hanging, but it definitely has been a journey, because even at 22 he had to have a hip replacement. I mean, it was mind blowing. It was something that I would have never even imagined experiencing, but it was great for him bodily. So we're gonna take this thing one day at a time, and we're gonna
that's all you can do.
And bring our biggest thing is awareness, because I never knew I carried a trait that could cause my child to have a life-threatening illness. So my major concern is advocating, and educating.
Man, I think don't leave, Taquel.
I'm not going nowhere. I have to go do something.
I'm going to say this on the broadcast right now. I think he's going to become a very good speaker, because people are going to search him out. At least we will, to so that you can inform other people or speak to other people about what you're going through and what you've learned so far in order to deal with your quote unquote disease, I call it. But I think I think you're going to end up talking a lot. I just believe that.
For sure, I'll talk to you. Get me on here. I'll join the live every other day.
I heard that.
Once a week.
No, probably about once a month. Not once a week. I don't do that much talking.
And I think it's important for you to raise your voice too, because you can impact people your age, young people who may be afraid of this journey, and they need a support system. You all can support one another, And the more we hear from you, it's kind of like what Dr. Jurassic said. We could talk about it all day, but if Tyquell steps to the mic and he's talking about it to people his age,
Absolutely.
they're going to listen. They really are going to listen, because they're going to say, he looks like me, and he's going through what I'm going through. So I want to know how he's dealing with it, because I'm dealing with it, and I can relate to what he's saying. So yeah, you have an incredibly powerful voice now and forevermore, because it is your fight, and only you know what you're going through and your family's gone through. So it sounds like you have a purpose, a real purpose here. And we just thank you so much for being with your mom tonight, taking the time to come out here and talk to us. And we certainly thank our special guests from MUSC for all that they do and for taking the time to be on our humble little show. And please believe that, even though there weren't a lot of comments tonight, people are watching and they will be talking about it. And that's what we want in the community. We create that buzz, get people to talking, and we can always do follow-up shows. I think this is our second show about sickle cell. Isn't it, Brother Edward?
Yes, it is indeed. Yes.
So anytime we have the opportunity to showcase the story or whatever, we want to make sure we do that to continue to educate the public. So, Brother Edward, I'll let you close it out.
Well, I think I've got another question for Dr. Jarosky.
Okay.
well, anybody can answer that. What would you say? What kind of caution would you give to people who don't know if they have the trait already? How can they get tested? I'll just ask that question. How can they get tested?
So there you could, if you have a question about it, you could always ask your pediatrician to do the test in their office. They'll draw blood, they can do the testing, and it will likely be covered by insurance, because it's an important thing to know. So being, having an inquiring mind and asking about it. Like Dr. Abrams mentioned, it's becoming more of an issue in the, young adult population who, may be thinking about starting a family. And for those people, I think that, having a screening event or, checking on college campuses makes a lot of sense, because then people know if they have the trait. So I think the more people understand about their health, the better off they are.
Mm-hmm. And I think another option might be some of the Red Cross blood donation centers potentially have screening for patients with sickle cell trait as well, or for individuals that think they might have trait. So it's a twofer. You can go try to donate blood and then potentially see if you carry the trait or not. And if you don't, then you'll be able to donate blood.
Mm-hmm.
But because the research that I've done, every state in the United States has been doing testing on every newborn for like the past 25 years. So I actually even called DHEC to get the results from my niece that I'm a caretaker for, and they were able to provide those to me also.
Mm-hmm. Yeah, so newborn screening
keeps those results forever.
Yeah, so universal newborn screening is now across the 50 states. So it's done within a couple days of individuals being born, and this newborn screen result should tell you whether or not you have sickle cell trait.
Mm-hmm. And Dr. Abrams, she informed me that September is Sickle Cell Awareness Month.
And Tyquell's birthday is in September, so we're going all month of September.
I was going to say, sounds like an event is on the horizon, Shauna. We need to do a screening event or something. We have to do something.
The entire month of September, we have something going on every weekend.
Awesome. Well, we definitely want to have you back to talk about that and put that in the magazine and get the word out. That's awesome. Yeah. So thank you, Dr. Abrams, for letting us know that.
Anytime that I can get information and awareness out about sickle cell disease, I'm happy.
And also June 19th is the National Sickle Cell Awareness Day also. So we'll have something going on in June.
We didn't know that, Brother Edward.
That's Juneteenth.
Yes,
it is.
Wow. It's the World Sickle Cell Day too. I think.
World Sickle Cell Day. Yeah.
Wow.
Yep.
Oh man, we have. This information is free.
Essentially, it is. Yes. Mm-hmm.
Yeah, and so we're free to the community. on WCM Live, we the co-host used to come has this. I don't know what to call it. It's, I don't know.
It's a slogan. It's a slogan, I guess.
Yeah.
I don't know, but it's called Free 99. This information is yours for free 99. Yeah.
That's good.
Yes.
Well.
And that's great because you know what? People will tune in because, they're getting this information. It's a great education. And a lot of times they're deterred from seeking the information because they think, oh, it's going to cost me a lot. I don't know how to do the research or whatever. This is, even though it may be scratching the surface, because I'm sure there's a lot to unpack, even more that you could talk about. We don't have enough time tonight, but at least they are getting a great foundational piece here tonight. Absolutely. And the starting point for what they can do to dig more into it if they feel the family's impacted by sickle cell. So yes, thank you all so much. Brother Edward, you want to close us out?
Well, I just closed that. I just said what I thought with Dr. Jaruskic. And she's been very helpful. All of you have been so
everybody,
helpful.
Yeah.
I mean,
Miss Mary, are you the one who's featured on the website? That picture, was that you?
Oh,
That's
yes.
her.
You do not want that picture.
Mary is everybody's auntie. It's Auntie Mary.
Auntie Mary, I love that. Auntie Mary, I love that. Well, thank you all so much for being with us tonight. We really do appreciate it. Shauna and Tyquel, blessings and peace to both of you. Yes, and anything we can do to help, please let us know. And we'd like to thank we'd like to thank all of our viewers for tuning in. Thank you, Miss Edna Bellamy DeWitt. She says, I'm so thankful to learn what I've heard, and that's awesome. And of course, Sister Joella, she's always the cheerleader in the background. Thank you, Bonnie Edie, for commenting tonight. For those of you who chose not to comment, but you're watching, please pass the word, share the link to this video, and we appreciate you viewing every single week. So with that being said, Brother Edward, I'm going to roll the outro.
Not intro, but outro.
Thank y'all.
Bye, guys.
Yes, thank you all so much. We really do appreciate it. Have a good night.
Good night.
Good night, guys.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner.